Thank you for joining us today. I'm Paul Rothman, the Dean and CEO at Johns Hopkins Medicine, and I'm here today with Gail Darmod, who is the new Vice Dean for Clinical Investigation at the School of Medicine. Hey, Gail.
Hi.
So, Gail, tell us a little bit about yourself. How long have you been here at Hopkins?
Yeah, I started as a fellow 25 years ago, and I've been on the faculty 22 years.
And you're in the departments of?
The Department of Medicine primarily, with joint appointments in psychiatry and behavioral sciences, and I'm in the Division of General Internal Medicine. I'm a primary care physician.
Wow. So you're more than just a primary care physician. Tell us a little bit about your work.
Yeah, so I'm primarily a clinician investigator, and my research program focuses on improving physical health and decreasing premature mortality for people with serious mental illnesses like schizophrenia.
What makes you take a role as now a Vice Dean?
Yeah, well, I love clinical research. I feel very passionate about it, and I want to help faculty be able to do their own research better. I believe that clinical research is critical for improving human health, and I want to make a difference.
What can we do as an institution to do our research, either make it easy for investigators, easy for the patients and participants, or more impactful? Tell me what your thoughts about what could we do to really change the way we do research and maybe improve it?
Yeah, this is really what I want to focus on. I really want to focus on making research easier, making our processes better so that we can do more of it and have more impact. So I think one of the first things we want to think about is how to have all the different people who are part of clinical research, so the investigators, the research teams, the staff supporting clinical research, have their operational processes be easier. How can we have data systems speak to each other better? How can we have better workflows, better templates, so that we can really make those operations better?
When we talked, one of the things that we talked about is the IRB, which at any institution, people always say that the IRB has to somehow be easier for the investigator. At the same time, it does what it does, which is really protect the patient. So do you see major changes in the IRB or the way we interact with the IRB? What do you think?
Well, so I think we're coming in with the Institutional Review Board being extremely strong. I'd like to work both within the IRB and also across some of the other clinical research support office and ancillary groups that support the IRB to look and see how we can have improved efficiencies, and also really, again, look and see how we can have faculty understand and navigate the processes.
Do you think the pandemic will change the way we do clinical research?
Yeah, I really do. I think that the pandemic both, provides challenges and opportunities, right? So we need to make sure that our patient participants feel safe and comfortable coming back to clinical research, non-COVID clinical research. And we also need to make sure our research teams continue to feel safe. So there's work that we can do in those areas. At the same time, I think that the pandemic has showed us that a lot of our human subjects research, we can use electronic or remote means to really engage people and really leverage our systems with survey research, electronic consent, using Zoom, and other techniques to really do some of our human subjects research that we always thought needed to be in person. We may not need to be doing that.
So you have this balance between the use of technology, which I think we all think will impact the way we do research, versus ensuring that we do that equitably across diverse populations. That's going to be a real challenge.
I think the whole issue of how to really look across our clinical research ecosystem and looking at diverse participants, how we serve them the best, is really important, and that's an area I want to focus on.
Great. Well, Gail, we are so thrilled that you're taking this position. You've had such an impact. You helped lead the Research Council, and I think you demonstrated that you're able to bring teams together, tackle tough problems, and solve them, both in your own research, across the institution, and now in this new role. So thank you so much for taking it, and we're so excited to have you. Thanks everyone for joining us today, and we know this is an exciting time for all of us, and we're so thrilled that Gail's going to leave us in clinical research. Thank you.
Thank you.